Mr. Angel. My name is Dulce. I'm gonna help you pick out a sweater today. It's a little chilly outside. Does that sound good? Okay. I have two options here. I have the pink sweater and I have the cardigan. Which one do you want? That sounds great. Let me close the door. Let me put some hand sanitizer on. Okay. Let me help you sit up so you can put the sweater on. Good job. Put these pillows so you don't fall back. Let me get the sweater for you. Let's do your left arm first. Okay, your left. Thank you. Let's do the right. Thank you. Okay, let me get the head part. Thank you. Let's get you all comfortable. One back. Okay, let's go back down. Okay, are you comfortable? Good job. Okay. So right here is a call light. I'm gonna leave it right here. So if you need anything, just press and I'll be here, okay? Thank you so much. Have a great day, Mr. Angel. Hi, I'll be showing you how to properly put on PPE. And PPE is pretty much protective equipment that we have to put on the employees to protect ourselves, the residents, and the patients from any hazardous material or any pathogenic diseases. And the first step of properly put on PPE is our gown. And our gown protects our clothing and skin from coming any like hazardous material, like bodily fluids. Like you could see this people wearing gowns in like surgery rooms or labor and delivery, etc. There's many ways of putting on why people have gowns on and stuff. So first step is making sure that you put your arms inside the sleeves and making sure that you put your thumb inside the hole. And later on I'll show you why. You'll see why these holes in the sleeves are very important. So after this, you put your head inside the hole. And just make sure that when you tie it on the back, that you tie it in a bow form. Because after you're done with, doing all the surgeries or labor and deliveries or coming in contact with any like pathogenic diseases, the bow on the back will just help you just, take it off and you don't have to like tug it or, get your clothes all dirty. Or you could just rip it off, which I'm gonna do. We got that. After this, you make sure that you put on any N95 mask or surgical mask. Make sure it's on right. And this helps protect myself and the patient or resident from any airborne diseases that we may come in contact with, like the flu, tuberculosis. So this is just going to be taught to us, like it's going to protect our nose and our mouth. And after, you put any goggles or eyewear that you may have, and this just protects your eyes, also airborne diseases, any droplet diseases, like splashing of fluids or blood. And after this, to protect our whole face, we put on our face shield. And this protects everything. So make sure this protects us from any droplet, airborne, everything's protected. And after, you make sure that you put on your gloves. So this is why this is in handy, because when you have this, you gotta make sure that our gloves are over the gown so we don't get anything inside our arms. Everything's covered. And make sure you put them on right. Well, you're set. Taking it off, so you make sure that you rip the gown. So this is off. So after you do this, you make sure that you take off your glove, and you get it this. Then from the inside where we didn't get any, like any droplet, any bodily fluid, we make sure that we take off the other one, and then we fold it up. So this, we gotta put it in a bag, because this is now hazardous material. Then we take off our face shield. Make sure we clean that. Then our eyewear. And then our face mask, or an N95 mask. After this, we make sure we tie it up. And make sure that we double bag it, in case it has any holes or anything. Make sure nothing is leaking out of this. Make sure you put the hazardous material inside. And you tie this up. And this is properly of taking care of any hazardous or linen that may be, like dirty or anything like that. So after we're done with our PPE, we gotta make sure that we wash our hands, and we're done.